your connection in Southern Oregon and Northern California. This is News 10 at 6.
Good evening, I'm Trish Close.
I'm Rick Tillery, thanks for joining us. Some health care insurance providers are canceling hundreds of thousands of Americans' policies.
News 10's Caitlin Conrad shows us how the cancellations may be linked to the Affordable Care Act in your top story at 6.
Hundreds of thousands of people are getting letters from their insurance company saying your policy is no longer available.
I was a little upset, to say the least.
The change coming in response to the Affordable Care Act. Ken Myers is insured through Blue Cross Blue Shield, but as of next year, he'll have to pay at least $600 more a year to get a new plan with them, and the coverage will be worse.
The $50 a month increase wouldn't really affect me that much. It's the deductibles that would eat me alive.
His deductible under the new plan going from $700 to $2,500 in-network and $10,000 out-of-network. The whole ordeal nerve-wracking for someone with ongoing health issues.
Being a senior citizen, you have constant health issues. I have degenerative disc disease in the knees and the back, which causes a lot of pain.
His pain specialist, just one of the doctors he's not sure he'll be able to keep because he doesn't know what plan he'll be able to get.
Things change literally daily on these websites that you go to.
One of those sites, Cover Oregon. The portal is still not up and running, which means no one trying to sign up for it knows what they'll be eligible for.
We're able to create an account for a client, but we're not able to run through it to see what they're eligible for yet.
La Clinica workers say they're not even using the site. Instead, they're printing out applications and mailing them in. Despite the inconvenience, assisters say patients are happy about Obamacare.
Oh yeah, especially those that haven't been able to get into Medicaid. They're really excited to be able to at least have this opportunity to try.
But what patients will be paying for health insurance if they don't meet Medicaid standards is still a mystery, just like it is for Ken Myers.
I was able to afford my insurance. I was happy with the insurance that I had. Now I've got something that I'm not quite sure what I'm going to get.
Covering your news in Central Point, Caitlin Conrad, News 10.
News 10 reached out to Blue Cross Blue Shield for a comment, but they did not return our phone calls. Let us know what you think, or who you think should be held responsible for the glitches in the new healthcare system. Like News 10 on Facebook and take the Your Voice poll on the Inside News tab at the top of the page.